inflammation, it is the neutrophil. So chronic Pseudomonas is such a chronic disease that shows the sign of acute inflammation. Why? Because it shows the presence of neutrophils, and neutrophils are seen in acute inflammation. So remember one thing, stick to basic. What are the cells of acute inflammation? There is only one cell, and that cell is neutrophil, which is also known as polymorphonuclear cell. For chronic inflammation, it is coming from a long time, long for lymphocyte. Most important being macrophage and the plasma cells. These are the three cells of the chronic inflammation. And we have exception on both sides for acute inflammation, the exception being typhoid, and because the typhoid shows lymphocytosis, relative lymphocytosis, and the exception for chronic inflammation is chronic Pseudomonas because it shows neutrophils. It is the vice versa. Now we have studied the acute inflammation and chronic inflammation. Now let's start with today's topic, that is acute inflammation. What are the events of acute inflammation? There are two events of acute inflammation. One is the vascular event. Something is going to change in the vessel. Something is going to happen in the vessel. Another events are cellular events. So there are 4 vascular events and there are 7 cellular events. The vascular events are shown in arterioles, capillaries, and venules. So this is not artery or veins. It is arterioles or venules or capillaries, basically the end of a blood vessel. These are the vascular events that are seen in the arteriole, capillaries, or venules, while on the other hand, the cellular events, these are the 7 events that we'll talk about. The 7 cellular events, as for 7 and cellulars, they listen very similar. So the 7 cellular events, they are seen by only and only WBC. Since we are talking about the acute inflammation, what are the cells of acute inflammation? These are the neutrophils or polymorphonuclear cells. So basically this cellular event is shown by which WBC? It is the neutrophil that shows the cellular events. Now let's talk about the 4 vascular events. Then we will talk about the 7 cellular events. The 4 vascular events are vasoconstriction. Constriction means something is pressed, constricted. Whenever you hear the word constricted, this means something is compressed. So if this is a normal blood vessel, the constricted blood vessel will be slight thinner. It is constricted. Vasodilation. If this is a normal blood vessel, then the dilated blood vessel is going to be dilated, means it is relaxed. So there is increase in the volume of this blood vessel. So first of all, the first event is going to be vasoconstriction. It is accompanied by vasodilation. Then there is increase in the vascular permeability. As the name suggests, increase word means something is increased. Vascular means blood vessel. Permeability means there is something is going to go out of the blood vessel. Permeable. Blood vessel is permeable, means something is going out. Fluid is going out of the vascular. Where? Vascular means blood vessel. Some fluid is going out of the blood vessel. And then status word means something is stagnant. So what flows inside a blood vessel? It is the blood. So what is stasis? It is the stagnation of the blood flow. These are the 4 vascular events. What are the 4 vascular events? First of all, there is constriction of the blood vessel. This is the first event. Constriction, vasoconstriction. Vaso word means blood vessel we are talking about. Constriction means it is constricted, it is compressed. So first, initially the blood vessel is compressed. What happens if there is some injury, there is inflammation? Suppose if there is a cut, the first thing is constriction. Otherwise what happens? All the blood will leak out, right? There is going to be loss of the blood. To prevent this, initially for few seconds, there is vasoconstriction. So the first event, what is the first vascular event in acute inflammation? That can be asked for viva, or that can be asked in exam. What is the first vascular event in acute inflammation? It is the vasoconstriction. It is a constriction of the blood vessel. So it is the first event, and in fact, it is a transient event. Transient event means it is it is basically a reflex that lasts for only few seconds, very short duration. It is kind of a reflex. If something happens, this is how the body reacts. So this is a kind of a reflex, that is vasoconstriction. It is a transient event. The first event, of course, it is a first event, and it is a transient event. It is a transient event means it lasts for few seconds. It is a reflex mechanism of the body. Then this vasoconstriction is accompanied by vasodilation. See guys, this is a blood vessel. It is dilated. Now what happens? There is increase in the blood flow here. Since the volume is increased, what happens when there is increase in the blood flow? There is going to be increase in redness, and that is known as what? Ruber. If you remember the 4 cardinal sign, ruber, tuber, dollar, calor. And the 5th one is functionalisa, which is given by Virchow. And all of these 4, ruber, tuber, dollar, calor, all of these are given by Celsius. So R for redness, R for ruber, increase in the redness. Since there is increase in the blood flow, because of that, increased in the temperature is seen, and that is known as calor. And the mediators here are histamine and serotonin. Now, what is the third event? Third event is increase in the vascular permeability. Now this blood vessel has become permeable. That means something is escaping out. Every blood vessel is lined by endothelial cells inside, and they are positive for CD34. What is the CD marker for endothelial cells? It is CD34. Then what happens? Because of the inflammation, acute inflammation, there is going to be something happening that is creating this fluid going out of the blood vessel. If this is a blood vessel, there is going to be exudate going out of the blood vessel. Plasma goes out, protein goes out, plasma proteins goes out, WBC goes out. So since a lot of things are going out, suppose if this is a plasma going out and these are the cells also going out of the blood vessel, what will happen? It will accumulate outside the blood vessel, and it is going to cause swelling in that individual. And this is another sign of inflammation, that is the tumor. Tumor is what? Tumor is the swelling. What is causing this swelling? It is the fluid that goes out of the vessel, blood vessel. So either it is arterial or capillary or venule. So basically most commonly seen in the post-capillary venules, but that we will talk about in a while, because this is a hallmark of the acute inflammation. This increased vascular permeability. This is causing all of the things goes out. Since it causes the exudate to go out, plasma goes out, plasma protein goes out, WBC goes out of the blood vessel because of the because the blood vessel has become permeable. Now permeability means something is going out of this membrane. Since it has become permeable, all of the things are gone out. When it goes out of the blood vessel, it accumulates in the surrounding area, and it is going to cause the swelling, and that is another sign of the inflammation that is known as tumor. The last vascular event is stasis of the blood flow. What do you mean by stasis? Stasis means stagnation. Now that the plasma has gone out of the blood vessel, now the RBCs are concentrated here. A lot of RBCs, because the plasma has gone out, the blood has become thick. So the viscosity is increased, and therefore there is decrease in the blood flow, and there is a slowing of the blood flow, and that is known as stasis. The blood becomes sluggish. The flow becomes slow or sluggish. So this is stasis. These are the 4 vascular events. Now, the first vascular event that we have studied is vasoconstriction. If this is a normal blood vessel, the first event that we study is vasoconstriction. Another event is vasodilation. The third event is increase in the vascular permeability, and from this plasma proteins, WBCs, everything goes out of the blood vessel. And the fourth event is, since there is a lot of plasma gone out in the space, and that is why here the blood becomes thick. Why? Because a lot of RBCs are present. So there is stasis of the blood flow, since the increased viscosity causes the decreased flow of the blood. What is the hallmark event of acute inflammation? The hallmark event is increase in the vascular permeability. The third part, increasing in the vascular permeability. Everything is going out. Plasma proteins, WBC goes out, and the vessel become permeable now. This is most commonly seen in post-capillary venules. It is most commonly seen in post-capillary venules. There are 4 mechanisms that we can say that this is the reason of vascular permeability. See, something is going out, plasma proteins, WBCs are going out of the blood vessel. If this is the endothelial lining, and in a blood vessel, if this is the endothelial cells. Now that I am saying that plasma protein, WBCs are leaking out because the blood vessel has become permeable. Why the blood vessel has become permeable? These are the 4 mechanisms that can occur. The first mechanism is that endothelial gaps are formed. Say suppose if this is a normal endothelium, what happens? if this endothelium gaps are formed, these endothelial cells, if one cell get retracted, another cell get contracted. So retraction and contraction, that can cause a gap between these endothelial cells. And from this gap, WBCs can escape out, plasma proteins can go out, and that can cause the exudate. So first mechanism over here is the endothelial gap formation, and that is because of the gap in the endothelial cells, because this endothelial cells causes contraction and retraction. And because of this, a gap is seen in the cells, endothelial cells, and from this gap, WBCs and plasma proteins and plasma goes out. This exudate comes out. And this is the most common mechanism of the increased vascular permeability. The most common mechanism is endothelial gap formation. Now, this is an immediate transient reaction. It starts and it ends immediately. So the mediators over here are histamine and serotonin that causes this endothelial gap formation. Another mechanism why there is increase in the vascular permeability can be direct endothelial injury. If this is the endothelium and if there is a direct endothelium injury to the endothelium, if I say this blood vessel is damaged, this endothelium is damaged, and those endothelial is damaged, that can cause the increase in the vascular permeability. Now, why this endothelium is damaged? Suppose if I say sunburn. If a person is in heat in the sun for a long period of time, in that case, there is a burn of the skin. This burning of the skin is going to cause the damage of the endothelium. So that can be, again, example for direct endothelial injury. So this response is a delayed, prolonged response. Delayed, prolonged. Why I say delayed and why I say prolonged? Delayed means that because so many hours of exposure in the sun is causing the direct endothelial injury. Why I say prolonged? Because when healing this kind of injury, it takes a lot of time. So the response here is long, prolonged, long response. Healing takes a lot of time. So since many hours of exposure of sun causes the sunburn, it is not like you go out in the sun and in 2 minutes you come with the sunburn. No, it doesn't happen like that. Suppose you have gone for a sun bath. That can cause for 8-10 hours of long exposure in the sun can cause this sunburn. So it is a delayed exposure, delayed prolonged response, delayed sunburn. Or another example, see the start is delayed and end is also delaying because the treatment healing takes a lot of time. So start is delayed, end is also delayed. Secondly, it can be immediate and a sustained response. For example, if I say sepsis, in the sepsis, there is large amount of bacteria that attacks the body. So it occurs immediately. A lot of bacteria suddenly comes and attacks the body. It comes immediately, but it stays for a long period of time. It damages organ one by one. Multi-organ failure is in one by one. It is going to damage the whole of the body, and it stays for a long time. So that is why it is an immediate and have a sustained response. So another example is sepsis, which is immediate and sustained response. These are the two examples for direct endothelial injury. Now coming to third mechanism of increase in the vascular permeability is WBC release something that actually damages the endothelial cell. If this is an endothelial cells, first mechanism that we have studied, these cells contract and these cells relax, and that is why a gap is created. Second mechanism that we have studied is a direct endothelial injury. Third mechanism that we are talking is leukocyte mediated. As the name suggests, that means if this is a WBC, if this is a leukocyte, it releases some enzyme and this enzyme destroys the endothelial cells. So this is leukocyte mediated injury. WBC is damage. Leukocyte damages the endothelial cells. The fourth mechanism is transcytosis. Trans word means through and cytosis word means cells. That means if these are the endothelial cells, this increased permeability is actually through these endothelial cells. As the name suggests, through the cell. There is some hidden tunnel that is present inside these endothelial cells. And these tunnels get activated and the plasma proteins and WBCs goes out. So this is known as transcytosis. That means it goes through the cell by a tunnel formation of VV organelle. These are vesiculovacuolar organelles. By VV organelles, these formation of tunnel and through which these WBCs plasma protein passes. And the mediator over here is histamine and VEGF. Now coming to the last mechanism of increased vascular permeability is angiogenesis. Angiogenesis means that new blood vessel. So what happens if this is a mature blood vessel? If this is a mature blood vessel, it is lined by endothelial cells, and these endothelial cells are nicely packed. This is inside here is the lumen of the blood vessel through which the blood flows. So angiogenesis is immature blood vessel. That means newly formed blood vessel, and endothelial cells are not packed here. There is a lot of gap here, and these are known as leaky channels. And through these leaky channels in these new blood vessels, there is increase in the vascular permeability. And the mediator again here is same histamine and VEGF. So basically these are the 5 mechanisms. The most common mechanism is gap is created between the endothelial cells, and that is known as endothelial gap formation. The 5 mechanisms that we have studied, the first one, why increase in vascular permeability is seen. The first mechanism is endothelial gap is formed by the contraction and the retraction of the endothelial cells. So one endothelial cell is contracted, another is relaxed. So contraction and retraction causes gap formation. If this is a normal endothelial cell, one is contracted, another one is retracted, and a gap is formed. And this is the most common mechanism. What are the other mechanism? There can be direct endothelial cell injury. There can be WBC mediated, leukocyte mediated injury. WBC releases some enzyme, and that enzyme is going to cause the damage to endothelial cells, and therefore there can be increase in the vascular permeability. Transcytosis means through the cell via a tunnel, that is VV organelle, vesiculo-vacuolar organelle. And the fifth one being is the angiogenesis, that is immature new blood vessels. These are known as the leaky channels, and through these leaky channels there is increase in the vascular permeability. So these are the increase in the vascular permeability. What are the vascular event that we have studied? 4 vascular event. Just to recall all the 4 vascular event. First event is vasoconstriction. If this is a normal blood vessel, the first event is constriction of the blood vessel. Next event is vasodilation, dilatation of the blood vessel. The third event is increase in the vascular permeability. And the 5 mechanism, we have just studied the 5 mechanism of increase in the vascular permeability. And most commonly it is seen in post capillary venules. Fourth one is stasis of the blood flow. Since a lot of plasma has gone out, the RBCs are concentrated here in the capillary or venule, basically the blood vessel. And here, since the RBCs are packed, there is increase in the viscosity. Blood becomes thick and it becomes sluggish. So there is stasis of the blood flow.